Brought to you by GTA, your island, your network.
A mandate to treat all patients, regardless of their ability to pay, has led the Guam Memorial Hospital into deep financial trouble. Just last year, the hospital received a $45 million bailout, $80 million short of what it hoped to receive in order to form a business model better suited for long-term sustainability. Committee on Health Chair Senator Dennis Rodriguez has been looking at alternative ways to help the hospital make ends meet. One option is a possible public-private partnership.
If you take a look at our GMH task force report that we put together about last year, right? It looked at other hospitals in similar situations as Guam Memorial Hospital that were government-run public hospitals, and looked at how their partnership with a bigger privately run hospital, what kind of benefits that had in terms of management, in terms of a centralized supply chain, where they get better prices for supplies and medicines, a bigger network of providers, of doctors. We have a lack of specialists here on Guam. Being able to partner with an established hospital group would be able to give us access now to specialists that we have a very hard time bringing over here.
A request for information was issued by the Guam Economic Development Authority last year and received responses from 3 companies from the U.S. mainland. Rodriguez says he plans to work with the GMH Board of Trustees on exploring this option and whether it's appropriate for GMH.
There's other things that we are doing that's very important as well, which is the expansion of access to health insurance. That in itself is going to be able to assist the hospital long term, because we know a big part of it is a large population that go there that don't have a payer attached to them.
His office is in the process of drafting and developing legislation relative to a healthcare para-toto plan, something he says gets to the root of financial issues at GMH.
By doing that, you're able to help the hospital, but you're really able to strengthen the overall healthcare infrastructure on our island when you're able to give over 30,000 of our people access to health insurance.
However, before the legislation is completed, Rodriguez is eyeing federal policy changes under the Trump administration and how these changes may affect local funding. Once that is determined, he'll have a better idea of how best to move forward. Reporting for Guam's News Network, I'm Isa Baza.
Brought to you by GTA, your island, your network.